certified financial planner, accredited investment fiduciary, and founder of Park Lake Advisors. I'd like to welcome you to another edition of 5-Minute Finance. The Centers for Medicare and Medicaid Services is the federal agency that runs Medicare. The program is funded in part by Social Security and Medicare taxes you pay on your income, in part through premiums that people with Medicare pay, and in part by the federal budget. Once you become Medicare eligible and enroll, you can choose to get your Medicare benefits from the original Medicare, the traditional fee-for-service program offered directly through the federal government, or from a Medicare Advantage plan, which is a type of private insurance offered by companies that contract with Medicare. Original Medicare includes both Part A, inpatient and hospital coverage, as well as Part B, outpatient medical coverage. If you want Medicare prescription drug coverage with Original Medicare, in most cases, you will need to actively choose a standalone Medicare private drug plan, or Part D. You still have Medicare if you enroll in Medicare Advantage plans. This means that you will still owe a monthly Part B premium and your Part A premium if you have one. Each Medicare Advantage plan must provide all Part A and Part B services covered by Original Medicare, but it can do so with different rules, costs, and restrictions that can affect how and when you receive care. Medicare Advantage plans can also provide Part D prescription drug coverage. Note that if you have health coverage from a union or a current or former employer when you become eligible for Medicare, you may automatically be enrolled in a Medicare Advantage plan that they sponsor. You have the choice of staying with this plan, switching to Original Medicare, or enrolling in a different Medicare Advantage plan. But you should speak with your employer or union before making any change. It's important to understand your Medicare coverage choices and to pick your coverage carefully. How you choose to get your benefits and who you get them from can affect your out-of-pocket costs and where you get your care. For instance, in Original Medicare, you're covered to go to nearly all doctors and hospitals in the country. Medicare Advantage plans, on the other hand, usually have a network restriction, meaning that you'll be more limited with your access to doctors as well as hospitals. However, Medicare Advantage plans can also provide additional benefits that Original Medicare does not cover, such as routine vision or dental care. Medicare is different from Medicaid, which is another government program that provides health insurance. Medicaid is funded and run by the federal government in partnership with states to cover people with limited incomes. Depending on the state, Medicaid can be available to people below a certain income threshold who meet certain criteria, whether it's age, disability status, or maybe a pregnancy. Or it may be available to all people below a certain income level. Remember, unlike Medicaid, Medicare eligibility does not depend on income. Also, eligible individuals can have both Medicare as well as Medicaid, which are known as dual eligibles. That's it for our quick hit on the basics of Medicare. Keep in mind, everyone who has Medicare receives a red, white, and blue Original Medicare card. If you choose to receive your coverage through Original Medicare, you'll show your card when you get services. If you choose to receive your Medicare benefits through a Medicare Advantage plan, you'll still get the original card, but you will show your Medicare Advantage plan card when you get services. No matter how you get your services, only give your Medicare number to your doctor or healthcare provider. If you have questions, don't hesitate to reach out via email at info@parklakeadvisors.com or phone 517-887-9905. Be sure to follow us on Facebook, LinkedIn, Twitter, YouTube, and popular podcast platforms worldwide for more quick financial bites. Until next time, happy learning.